I think there's several documents stacked together, basically.
Yeah, you'll see their turn.
We're passing those out. My name is John Shinholser. I'm the director of the American Kratom Veterans for Kratom Safe. And I'm also a person in long-term recovery from substance use disorders. I've been clean and sober over 42 years. I'm a Marine Corps veteran, got clean in the Marine Corps. And, for the last 20 years, I ran a charity. Me and my wife co-founded the McShin Foundation in Richmond, Virginia. And it turned out it's a peer-run organization. It turned out to be like the national model for our nation. And, over the last 20 years, we have over 11,000 alumni. And I've circumvented the nation, taught communities how to, start recovery community organizations, recovery community centers. I've spoken in jails and prisons in 46 different states. I've done some marvelous reentry work. We've passed laws in Virginia. In 2012, we were the first red state to pass the Narcan bill. We had Medicaid expanded in the red state. We had the Good Samaritan bill passed. We had the mental health addiction parity bill passed in Congress. We had the mental health and addiction inserted in the Affordable Care Act. So I'm very active, very knowledgeable on the subject of addiction and recovery. About 10 years ago, kratom came up on our drug test. Now, I didn't know what it was, and these kids are taking kratom while they're in a recovery center. And the one thing is, we didn't know they were on anything. I kept asking, why are you taking this product? He said, well, it helps me with anxiety, PTSD. It just, I don't get high on it per se. It's instead of a psychotropic, I use kratom. Well, that wasn't good enough for me. And then I Googled it, and you go on the internet, and all you see really is what the FDA put out. And the DEA takes their lead from the FDA, and then John Hopkins or the Mayo Clinic. And so it looks really bad if you Google it. And so, I went to one of the processors, the person that actually imports it, processes, and distributes it. And we're 10 years back now. This is 10 years ago. I want to learn about it because I'm in a harm reduction. What's going to help an addict? When it comes to harm reduction, we pioneered buprenorphine, which is the active ingredient in Suboxone, in 2004 when no recovery organization wanted to touch it because they were hung up on abstinence. And so this is what I found out, that in this day and age, in 2024, we have 48 million Americans need recovery. The doctor that spoke earlier, he knows there's that many people, but they don't want to go get it because they don't want that antiquated abstinence-based system of care. And so only like 3-4 million people a year get help. So there's like 45 million people out there not getting help. So that led me into harm reduction. And harm reduction is where people who lived experience go into communities, and they talk to folks. They try to, wouldn't you like to get on medication? I can get you in an outpatient program, get you in sober living. Well, and then fentanyl took off, skyrocketed. So our illegal drug supply is fully contaminated. You don't know if you're going to live or die by taking a substance. Well, kratom, and we're not, keep in mind, we're asking for regulations. We're not asking for the way it is right now. We do want regulation because if it's regulated properly, it solves most of the problems we currently have. Like the doc mentioned, these potent products on the market. And half of them he's talking about, they're not even kratom. They're calling it kratom, but it isn't. It's an adulterated version that we want out in the marketplace. So we're 100% behind that. And I can tell you exactly what products are what, too. We're really good at that. So here you got an opportunity for an FDA regulatory manufactured processed kratom product that what you get every time you take it versus an illegal drug supply. I don't know of a parent in America who lost a child to an overdose that wouldn't rather have their child on a GMP product, a good manufacturing product, a kratom product. So the benefits far outweigh the disadvantages of it. And the doc mentioned the Tampa Bay Times article where it was 46 deaths that they said was kratom only. Well, after the forensic scientists redid the autopsy, they realized that 40 of them had poly drug use in them. One of them was killed in a car wreck. He wasn't even driving the car, I don't think, but they called it a kratom death. And I point that out because there's so much bias toward kratom from the FDA and the DEA and the Mayo Clinic, who they all take their same play from the FDA. In 2016, the FDA tried to ban kratom, and they got the DEA involved. Well, when the DEA realized that the FDA didn't follow the 1994 DSHEA Act, Congressional Statutory Regulations for banning a substance, that they were hoodwinking the DEA into saying something was bad that wasn't bad, the DEA said, well, we're not touching this. And that irritated the FDA to this day. The FDA, if this was such a bad product, it would have been banned in 2016. We wouldn't have been having this discussion. But the science, now here's where it gets very interesting.
Mr. Shinholser, I'm going to have to cut you off. You're at 5 minutes. I appreciate you coming. I have one question for you, and maybe you or Dr. McCormick, one can answer this. You said that kratom showed up in a drug screen.
Right.
What did it show up as?
Kratom. We did like a.
You do a kratom?
Yeah, it had the kratom drug screen. Most drug screens you can buy 3-panel drugs, 6-panel, 12-panel, 15-panel. We use all confirmation drug tests. We use 12-panel screens. We test for things that China brings in here, and kratom's not a China chemical, by the way. You know, it's a plant.
So the question that I asked them last week, some of the representatives, about showing up in the drug screen. It's a lot of public employees out here, and I asked them that specific question: will it show up in your drug screen? One said it does, and
if it's a kratom drug screen, the drug screens have you can be cheap and buy a $2 one. It only tests for opiates and pot, but you can get a $10 one and test for 20 different substances, including kratom.
Yeah, but that's a problem. It don't show up.
Well, that's on DLC. You know.
So you saying it's on DOT? So my question is, what about the human being?
The human being?
Yeah, you said that's on DOT, showing it up in that system. What about the person that's taking this product?
DOT? Is that what I'm hearing? Well, different agencies use different screens for drug tests. They may not want to test for it because they don't have a problem. It's like schools don't want to test for drugs because then they got to deal with it.
Anyone else have any questions for Mr. Shinholser?
I'm fine.
Okay. Thank you, sir.
Thank you for your time.
Yes, sir. I appreciate you.